This is Joe Dustin. I'm here with Kara Dennis from Medidata, and you're at Geeks Clinical. Today we are at the Health 2.0 conference in San Francisco, which is a healthcare conference that's really focused on technology, but more on the healthcare side as opposed to what we at Medidata are used to, which is clinical trials. And we're here learning a lot about some of the new technology that's out there today to support healthcare when really dealing with things that integrate electronic medical records, keeping patients adherent to their medication, and a lot of different technologies around that space. And it's really interesting for us to kind of be here and suck this in as far as information, because it's a different paradigm that deals with something that's outside of clinical research after drugs are already approved. But we still see a lot of similarities and a lot of synergies that could actually apply to clinical research. We can learn something from it, actually.
Yep.
And Kara's seen a lot today, especially.
Yeah, so two things stand out to me. One is the commentary that more data is available than ever before, and more can be measured and tracked and acted upon than ever before. And that's true outside clinical development, but it's also very much true in our space. So there's a lot of work with structured clinical data and sending that data back to physicians and patients to empower them. And that's one thing. Second thing is there's an enormous amount of work going on to empower patients to take care of their own care, to track what they're doing, to remember to take their medications, to be engaged with the physician community and the broader patient community that has their given disease. So we think there's a tremendous amount of innovation in that space, and we're excited to pull it back into our clinical development platform to make clinical trials more powerful, faster, and more effective.
It's really interesting that you say that about pulling it back into the platform. It's interesting to see these different technologies that actually fill really good gaps of things that are things we're looking for today, and even things that we never even thought we could do in clinical trials. And it's really innovative. In fact, so innovative that Janssen, part of the Johnson & Johnson, was here, and they did sort of a deep dive for basically entrepreneurs. It was basically their Shark Tank. And they came in and they had 2 minutes to do a pitch, and they had different tables focusing on adherence, on care, and on compliance, I think it was. There was also a clinical trials part of that, which they were not representing today, but something that we know about. But as far as that's concerned, it was really interesting to see the chaotic madness of like an entrepreneur Shark Tank at a conference like this. It was actually really cool, and I heard a lot of those conversations going on. And Janssen, especially, is an innovation department within their organization that's trying to find these new technologies out there to plug in whatever way they can to transform clinical development and make it better. And it's interesting working in Medidata to see that at the forefront happening. So this is great being here. This is really good for us.
Thanks to Health 2.0.
Yeah, thanks for having us.